we know, and you know, there are significant challenges facing the healthcare system right now, that this is going to be a difficult winter because we're going to see, and we've seen this in the Southern Hemisphere already, significant increases and challenges related to respiratory illnesses, including, but not limited to, COVID-19. And that means we're taking, all of us, short-term measures to prepare for that and necessary short-term actions. And we need to build out for future expectations of the healthcare system. Public healthcare has demonstrated its value to every Canadian in the pandemic, and we have to take that support for public healthcare and respond to the challenges and difficulties facing the system today by our healthcare workers and by our patients. And this group of provincial health ministers and the health systems across the country are determined to do just that. Of course, at the core of that, everybody pulling their weight in their jurisdictions, the extraordinary effort we've seen, are seeing, and will see at the provincial level, we need support from our federal partners. And today we reiterated our call on Canada's Canada's premiers, led by Premier Horgan over much of the last year and now by Premier Stephenson, for a renewed healthcare funding partnership with the federal government delivered through the Canada Health Transfer. The degree of unanimity and support for this over a period of months as we have waited for any federal response has been a source of strength, demonstrates the willingness to focus on what matters to people, which is the quality of care and the delivery of services, is demonstrated again today by our united and common approach to see a change in the Canada Health Transfer and an increase in the Canada Health Transfer such that we can meet the demands of the future. The united position of Canada's premiers seeks to increase the federal government's share of provincial and territorial health costs to 35% and to maintain it at this level going forward. The Canada Health Transfer is the most efficient mechanism for federal funding support because it ensures that provinces and territories have the means to address their diverse system needs and priorities to deliver the tests, procedures, and health services Canadians across the country need when they need them. And so we are looking forward, of course, to meeting with the Federal Health Minister, Minister Duclos, tomorrow. We've heard, as all of you will have, a willingness by the federal government to increase its share of the Canada Health Transfer. And of course, the federal government saying that they are prepared to invest more is good news. And we look forward to seeing details. We hope that such an announcement and any discussions we have tomorrow lead to what we have been wanting and expecting for months, really since one was promised and announced in 2015 in the incoming government's election platform.